There are other barriers to communication, and language barriers are one of them. So there's disadvantages that may be present when a patient and the healthcare provider don't speak the same language. This makes things very difficult. So what happens when we have these language barriers? Well, the opportunity to develop rapport is reduced. It's very difficult to do that if you don't speak the language. The use of small talk is basically thrown out the window because we can't really engage if we don't know the language. And the patient and the healthcare provider have to rely on usually a medical interpreter to deliver this information. Now, the patient may be less likely to effectively convey his or her complaints or concerns because of language barriers. So this may be difficult in terms of treatment. The healthcare provider may be less likely to effectively convey the patient's diagnosis and recommendations. Again, language barriers can really put a damper on the communication process. There can be adverse medical events in hospitalized patients because of language barriers as well. When we think of people that we work with that speak a different language, we only want to use medical interpreters. The use of non-professional interpreters, such as like family or friends, any loved ones, can be disadvantageous. They're often unfamiliar with the complex medical information and may give incorrect translation. So we have to be really careful not to use someone who is not a trained professional for interpretation. There's also the loss of patient confidentiality that may make the patient uncomfortable, so they may not be very candid. They don't want to say much in front of the interpreter, and they may withhold potentially important information. So there is a drawback as well. Here are some strategies that we can use to work more effectively, especially with the medical interpreter. We tend to look and speak directly to the patient, not the interpreter. We use short sentences, again, keeping the information very short, very brief. We avoid the use of informal and unprofessional vocabulary. We also like to remain patient and understanding because this is a process in order to translate back and forth. We have to observe the patient's nonverbal messages, like is the patient uncomfortable or do they seem confused by the interpretation? Repeating important information, and if the information is still not understood, we may want to think about rephrasing what we're saying. I like to employ the teach back method, and this is basically where we ask the patient to paraphrase what we have just instructed them to do. And that seems to be very helpful in the communication process. There are individuals with visual impairments as well, and vision loss refers to difficulty with seeing even when wearing corrective lenses, as well as complete blindness. And well over 25 million Americans experience significant vision loss. Here's some strategies that we can use to work with individuals with visual impairments. Make sure to greet the patient, face to face, speak directly to the patient, and tell the patient that you will be touching him or her before you do so. We should always obtain consent for touch prior to placing our hands on the patient. We want to be as verbally descriptive as possible. It's extremely important to have a large vocabulary bank in able to do this. And then we want to tell the patient when we are leaving the area or when we're coming back into an area. Do not attempt to guide the patient without first asking. Usually they'll say, I need assistance or I need help. With guidance, I allow them to either place their hand on my forearm or onto my shoulder as I guide them wherever I need them to go. Never touch or distract the patient's service dog. If they have a service dog, you let the service dog be. We will walk with the patient between you and the service dog, so the dog is on one side, or the service animal is on one side, and the therapist is on the other side of the patient. And we should always try to provide reasonable accommodations.